In the United States, the flu is primarily in certain times of year. So flu season typically runs between October of the fall of one year till up as far as May of the next year. So we usually recommend that people be immunized for influenza up until October is the best time, and that protects them through the entire flu season. But if someone is unable to be immunized during that time, we continue to recommend that people be vaccinated until flu season is over. It's actually recommended that everybody over 6 months of age be immunized in this country, but there are certain people who are at higher risk for influenza and higher risk for developing complications from it. Signs and symptoms of the flu are respiratory symptoms, so most people have a sore throat, a runny nose. People do tend to get a high fever with it, and chills, and pretty severe body aches to the point, you can't even touch your head, your hair hurts, everything hurts. There are medicines to treat the flu, so it's best to actually go to the doctor sooner rather than later, so those medicines can be started, and it maybe decrease the severity of the flu and also the duration of your symptoms. So other things that people can do to, prevent getting the flu is, to avoid contact with sick people. If you're coughing or sneezing, to use a tissue to cover your mouth, your nose, and then throw the tissue away. To wash your hands frequently, preferably with soap and water, but if that's not available, you can use hand sanitizers. And if you're sick, to stay home and, avoid contact with other people. If you ignore it and you do get the flu, most people are pretty sick with it, can't get out of bed, can't go to work, can't take care of their families. The symptoms can last anywhere from a few days, 3 days, to up to a week or so. And some people, even to get back to their baseline activities, can even take up to a week or two. So the flu can be pretty severe. And in our seeing patients in the hospital every year, we often see someone who is otherwise healthy, a young person, teenager, someone in their 20s who winds up very sick from the flu, can be put on a ventilator. Even have seen people, young, otherwise healthy people, die from the flu. So it's definitely important to get the vaccine.